Item number 6, SB 10, X2, Senator Bell.
Thank you, Mr. Chairman. I present this bill before this committee regarding the Board of Equalization tobacco licensing. Just to give you a background, in 2003, we enacted in California the Cigarette Tobacco Products Licensing Act. This established a statewide licensing program administered by the Board of Equalization. The act was established to reduce untaxed distribution and illegal sales of cigarettes and tobacco products. Under the act, the tobacco retailers must pay a one-time fee of $100 for each location that sells tobacco products and cigarettes. The license is valid for 1 year and must be renewed annually with no additional charge to renew a license. So they have to renew it annually, but they don't get charged for the renewal. Tobacco distributors and wholesalers instead pay an annual licensing fee of $1,000. Current licensing fee structure does not generate the necessary revenue to cover the administrative costs associated with licensing. Of course not. It's a one-time fee. It's an annual license. They have programs to fight illegal sales of tobacco, but they only have a one-time fee. So what happens is the LAO and the BOE have published these reports that outline inadequate funding. The reports highlight that inadequate funding of this program can lead to a lack of field enforcement or the reduction of compliance staff, potentially leading to further decreases in funding. So what's happened is, to make up this shortfall because we only have a one-time fee and ongoing expenses, what they did is they take money out of special funds for childhood development, tobacco education, prevention, tobacco-related research, and health care for low-income persons, among others, and are charging these programs part of the cost of administering the licensing program to make up the deficit. To remedy this problem, this bill will eliminate the need to divert this tobacco excise taxes from these intended purposes to pay for the deficits by replacing a one-time fee with a $265 ongoing fee, and increase the tobacco wholesalers and distributors fee from $1,000 to $1,200. And that's it. I thank you for your support. It's pretty cut and dried. You understand it, and that's the bill.
Thank you. Anyone like to speak in support of the measure?
It's about a $7 million a year deficit. Something like that, $7 million.
Thank you.
Good afternoon, Kula Koenig with the American Heart Association, American Stroke Association. We are in strong support of this bill because it addresses a problem that has existed for far too long. As Senator Bell mentioned, the Board of Equalization does not have adequate funding to cover the cost of running the tobacco licensing program. The reports he mentioned, so the LAO office stated that from 2005 to 2014, annual expenditures averaged $7 million more than the annual fee revenue. So that's a deficit they were running. The report noted that for the 2013 to 2014 year, it cost approximately $10 million to run the program, and revenues remained stagnant around $2 million. So by adjusting the fee, we would generate approximately $12 million and thus equip the BOE with the resources it needs to prevent untaxed distribution and illegal sales of cigarettes and tobacco. The BOE has stated that without proper resources, the organization would have a difficult time discouraging tax evasion. They also noted that lack of the ability to enforce could jeopardize the California Master Settlement Agreement payments if it's determined that California is not diligently enforcing its cigarette and tobacco product statutes. The bill simply asks tobacco retailers, wholesalers, and distributors to pay for the cost of doing business in the state. According to the California Department of Alcoholic Beverage Control, other licenses, such as the state liquor license for stores that sell beer, wine, and spirits, have an origination fee of $13,000 and an annual renewal fee of $582. This is fair and sensible public policy, and I ask for your aye vote.
Mr. Chair and members, Autumn Ogden with American Cancer Society Cancer Action Network. We are proud support of SB 10. We believe this will provide critical funding for the Board of Equalization to adequately administer the cigarette licensing program. In 2006, in response to the budget deficit of approximately $7 million, the legislature approved a budget proposal allowing the BOE to fill in their funding gap by siphoning funds from 4 other funding sources: the General Fund, the Breast Cancer Fund, Prop 10, which funds First 5, and Prop 99, which funds the Tobacco Control Program. The money being diverted funds other critical programs which support tobacco education and prevention, tobacco-related disease research, health care for low-income persons, and childhood development. The Tobacco Control Program, for example, is already underfunded and only receiving 17% of the funding recommended by the CDC. By allowing the BOE to divert tobacco excise tax revenue to cover their shortfall, we deplete life-saving programs of critical funding. Furthermore, funding from these programs through Prop 99 and Prop 10 raises questions of legality, as the voters never approved these funds to be used towards this program. By revising the Cigarette and Tobacco Products Licensing Act of 2003 to increase licensing fees, the BOE will be able to cover the costs of these programs without having to pillage funding from other critical programs that are already suffering. For these reasons, we ask for your support.
Thank you. Name and position, please.
Erin Gable on behalf of First 5 California, in strong support of this appropriate funding source for tobacco control and regulation. Thank you.
Jerry Chaffee, representing the California Chronic Care Coalition, in support.
Gregory Kramer on behalf of Planned Parenthood Affiliates of California, in support.
Jasmine Gordon with the California Black Health Network, in support.
Alexis Fernandez on behalf of the First 5 Association. Our commissions are carrying the burden of covering these costs.
Kimberly Chen with the California Pan-Ethnic Health Network, in support.
So I assume Health Access California, in support.
Megan Allred, California Dental Association, in support.
Alicia Sanchez, representing the California Medical Association, in support, and also helping the California Society for Addiction Medicine in their support.
Thank you, Mr. Chair. Members, Fred Notler, representing the Medical and Oncology Associations, in support.
Kelly Beam on behalf of the March of Dimes, in support.
Lydia Bourne, American Academy of Pediatrics, in support.
Lindsay Freitas, American Lung Association in California, in support.
Dr. Donald Lyman, California Academy of Preventive Medicine, in support.
Terry Brennan, SEIU, California, in support.
Thank you. Opposition? Questions, comments from any of the members? Questions, Senator Morlock.
I'm just curious, Senator Bell, if we eliminated the fee altogether and didn't have to collect it, we would save $7 million?
Yeah, that is true, except then you allowed all the cheaters and thieves to run amok in California, so we won't have any enforcement. So they'd be able to sell cigarettes to minors and do all those kinds of things without any enforcement. So that's why we have this enforcement program. So we can deregulate, we can do that, but then there's nobody to catch the bad guys. Well, we need to have more than the 25-30% cost recovery on these things. So,
So what does the ATF do? They're doing excise tax as well. Have we ever thought of doing a relationship with them where we pay them to collect our fees?
Yeah, they're involved in that, but I think the Board of Equalization is the tax collector, and I think you've got to realize they're the direct responsible party in the legislation that we have. So if we're going to have a law, we should enforce it.
Right, but if we asked the State Board of Equalization to contract with the federal government, we could reduce their costs. Right?
Yeah, introduce a bill. Let's look at it.
Yeah, I'm just asking.
Go ahead. See, that's an idea, but for now, I think we ought to approve this, so at least we're cost recovery.
All right.
Yeah.
Thank you. We have a motion by Senator Pan. Seeing no other questions. Item number 6, Chair is recommending an aye. Do pass to appropriations. Call the members, please.
Hernandez.
Aye.
Hernandez, aye. Morel. Anderson. Bell.
Aye.
Bell, aye. Hall. Hall, aye. Leno. Leno, aye. McGuire. McGuire, aye. Mitchell. Monning. Monning, aye. Morlock. No. Morlock, no. Nielsen. Nielsen, no. Pan? Pan, aye. Wolk? Wolk, aye.
Currently has 8, enough to get out. We will place that bill on call. We have some absent members. We're going to move on to item number 3, SB 7, Hernandez.
That's awesome.
Yeah, I just don't have the, if the clerk could help me out, but should I read this is going to be SBX 2-7 by Hernandez, and we are honored to have the senator present.
Thank you very much, Mr. Chair and members. The truth, as Harry Waxman once stated, is that cigarettes are the single most dangerous consumer products ever sold in this country. This bill would increase the tobacco purchase age to 21, and you would ask the question, but why? Tobacco remains the leading cause of preventable death and kills 480,000 individuals in the United States, 34,000 in California. Tobacco use kills more individuals per year than alcohol, murder, illegal drugs, AIDS, and motor vehicle accidents, according to the CDC. Additionally, it is estimated that 90% of lifetime users start before the age of 21, and 80% first experience before age 18, often furnished through illegal or through legal sales. If the vast human toll was not reason enough, there is also significant financial costs related to tobacco use. In 2009, a UCSF study estimated tobacco use cost Californians $18.1 billion, more than half from direct health care expenditures. It is estimated that Medi-Cal spends $3.5 billion annually in health care costs attributed to the use of tobacco. At a time when Californians are concerned with growing health care expenditures, this bill has enormous potential to substantially reduce tobacco use, which in turn would have large impact on health costs, both on individuals and in the state of California. Will this work? Well, the Institution of Medicine, in an FDA Commission report to Congress, recently reported that increasing the age to 21 would result in a 12% additional decline in tobacco prevalence and 250,000 fewer premature deaths for those born between 2000 and 2019. It should not be so easy for our children to get a hold of this deadly drug. The time is to act now. This bill provides a new solution to combat the continued use of this poisonous and ultimately deadly product. I have witnesses with me that like to speak in support, and I respectfully ask for an aye vote, Mr. Chair and members.
Witnesses in support.
Thank you, Mr. Chair and members. My name is Callie Hampton. I'm here on behalf of the American Heart and American Stroke Association, proud co-sponsor of this bill. Smoking is the #1 cause of preventable death and disease in the country and in California, and last year 43,000 Californians lost their lives to this deadly addiction. In addition, it costs the state in direct cost to Medi-Cal of over $3.5 billion alone. Every year, 21,000 California's children start smoking, which equates to 45.4 million packs of cigarettes being bought or smoked by kids. In fact, national data shows that 95% of adult smokers begin smoking before they turn 21. This is a problem in desperate need of a solution. As the Senator mentioned before, the IOM report found that increasing the minimum age of sale for tobacco products could benefit public health by reducing youth tobacco use. The report also found that tobacco use would decrease by 12% by the time today's teenagers were adults if the minimum age of sale were increased to 21. The science is very clear. Increasing the legal minimum purchase age of tobacco is good for our economy and good for our health and good for our communities. In July, Hawaii raised their legal minimum purchase age of tobacco products to 21, and in California, Healdsburg and Santa Clara County currently do the same. More than 80 communities in 7 different states have raised their tobacco sales age to 21. Other states have minimum purchase ages that are different than 18. They include Alaska, Alabama, Utah, and New Jersey. California has a rich history of strong tobacco control policies that have helped reduce smoking rates. Increasing the age of sale of tobacco, combined with other tobacco control measures before you today, will help to further reduce smoking rates in California and will reduce tobacco-related illness costs in Medi-Cal and save thousands of lives. We ask for your I vote today. Thank you.
Good afternoon. I'm Dr. Donald Lyman, representing the California Medical Association. Recently retired from state service, where I was your senior civil service physician in the Department of Public Health. One of my responsibilities was starting and operating the tobacco control program. We were quite successful. We have now reduced the adult smoking rate by about 50%, from about 22% down to about 11 or 12%. Concurrently, the decreases in cancer rates are substantial. The decreases in heart disease rates are substantial. It is a wonderful success. The legislature has mandated us to reduce that adult smoking rate to 7%. We're at 11 to 12 now. We've got to get it down to 7 because you told us to do that. What we're looking for are now high-risk populations, which we can address, which can drive that smoking rate down. This age group is a very attractive target for that activity. The tobacco industry agrees. They have preferentially directed their marketing efforts to this age group, and they put lots of money into it. And there are two good reasons for that. The first is that this is the group which can now legally purchase tobacco, which is at the highest risk of addiction. So when this age group smokes, their likelihood of going on to addiction is the highest of all people who can legally buy tobacco. The only group that's higher is teenagers, and they're now prohibited from buying tobacco. So this is a group which is at high risk of future addiction, lifetime purchasers of tobacco, if they can get them to try those tobacco products. That high addiction rate plateaus out at about the age of 25 and then stays low and fairly low for the rest of a person's life. So that's number one reason for them to attack this group. The other is that this is the portal for tobacco to the younger people, to people under the age of 18. These are their friends from high school and elsewhere. So the tobacco these people get comes through their friends who are in this age group. It is a very dangerous situation for those children. And for those two reasons, we are very anxious about this group, and we're very hopeful that we can raise the age, and in that act, move us closer to the 7% adult prevalence that you've asked us to reach. Thank you very much.
Mr. Chair, members, Tim Madden, representing the California chapter of the American College of Cardiology and the California chapter of the American College of Emergency Physicians, in strong support.
Other witnesses in support?
And Terry Jeffy, representing the California Chronic Care Coalition, in support.
Teresa Stark on behalf of Kaiser Permanente in support.
Terry Brennan, SEIU California, in support.
Kelly Brooks on behalf of the Board of Supervisors of Santa Clara County and the Association of California Healthcare Districts in support.
Jasmine Gordon on behalf of the California Black Health Network in support.
Kimberly Chen with the California Pan-Ethnic Health Network in support.
Tim Gibbs, American Cancer Society Cancer Action Network, proud co-sponsor.
Lindsay Freitas, American Lung Association in California, also proud co-sponsor.
Kelly Beam on behalf of March of Dimes in support.
Brandon Roberts with the Health Officers Association of California in support.
Lydia Bourne, American Academy of Pediatrics in support.
Megan Allred, California Dental Association in support.
Alexis Fernandez on behalf of both First Five California and the First Five Association in support.
So I assume on behalf of Health Access California in support.
Fred Notler, representing oncology, in support. Thanks.
Great. Any witnesses in opposition?
Mr. Chair, members of the committee, Paula Treat on behalf of the premium cigar retailers. On principle alone, they're opposing this, that they figure if you're 18 years old and you're going to war, you ought to be able to smoke a cigar. So it is what it is.
Angela Haywood on behalf of the NAACP in opposition to this bill for the reasons previously stated.
Dana Nickel with Pete Conantine and Associates, representing AMVETS, the American Legion, the Military Officers Association of America, and the Vietnam Veterans of America. In 1971, the age to vote was lowered from 21 to 18. A backdrop to this was the war in Vietnam. It was argued that if you are old enough to fight and die for your country, you're old enough to vote. We maintain that if you are old enough to serve in the military, you should enjoy the same freedoms of choice that the rest of the adult population is. Thank you.
Thank you. Any others in opposition? Any questions for the author? We have a motion to move the bill to do pass to appropriations. Why don't we take the roll? Oh, no, we don't want closing it. No, go ahead. I'm sorry. Senator Hernandez, we'll have some closing
Mr. Chair, members, I respectfully ask for an aye vote.
Go ahead and call the roll.
Hernandez?
Aye.
Hernandez, aye. Morel? Anderson? Bell? Bell, aye. Hall? Hall, aye. Leno? Leno, aye. McGuire? McGuire, aye. Mitchell? Aye. Mitchell, aye. Monning? Monning, aye. Morlock?
No.
Morlock, no. Nielsen? Nielsen, no. Pan? Pan, aye. Wolk? Wolk, aye. Morel, no.
Is that 8-3? Okay. Then I will gladly give the gavel back to the chair.
Thank you.
Thank you for the privilege.
I believe Senator Anderson is absent. If we can call the absent member so we can lift the call. Is he coming or not? Do you know if he's coming? So, you want to verify? So. I believe Senator Nielsen had a comment.
One vote.
Yes, Mr. Chairman, thank you for allowing the comment. I figured it to be better to do this at the end, but I say this with all sincerity and with passion and no hints of facetiousness at all. I would hope that all of those well-intended and people who spoke here today in support of these many bills would be similarly concerned about marijuana smoke and its deleterious impact on our brains and our health and the impact on our children, and that they would be heedful and mindful of that prospectively as marijuana becomes an increasing issue for our children and all of us.
Thank you, Senator. We're going to go ahead and lift the call for all the bills. My understanding is Senator Anderson won't return, so we're going to start off with item number 1.
Before you do that, Mr. Chair,
sure.
If I could just say to you and the committee members, the members of the public, I apologize. My absence here was as no result of my lack of belief in the importance and integrity of the issues being discussed. I am a Rules Committee member, and we had some pretty controversial confirmations that required that I was there. So please accept my apology, but I'm ready to cast my votes.
Apology accepted.
Thank you.
So we're at item number 1, SB 5. Leno, call the absent members.
Anderson? Mitchell? Aye. Mitchell, aye. Nielsen? Nielsen, no.
That vote count is 9-3, and that bill is out. Item number 2, SB 6, Monning. Call the absent members.
Morel? Anderson? Mitchell? Aye. Mitchell, aye. Nielsen? Nielsen, no.
Current vote count is 9-2, and that bill is out. Item number 3, SB 7, Hernandez. Call the absent members.
Anderson? It's 9-3.
Vote count is 9-3. That bill is out. Item number 4, SB 8. Lou, call the absent members.
Anderson? Bell? Bell, aye. Mitchell? Aye. Mitchell, aye.
Current vote count is 9-3, and that bill is out. Item number 5, SB 9. McGuire, call the absent members.
Anderson, Mitchell, Mitchell, I. Morlack.
Current vote count is 9-2. That bill is out. Item number 6, SB 10, Bell. Call the absent members.
Morel, Morel, no. Anderson, Mitchell, Mitchell, I. 9-3.
Current vote count is 9-3. That bill is out. That concludes the business of the day, and we are adjourned. Thank you.